Hi everyone, welcome to the community classroom and our channel. This is Dr. Tracy McCarthy, psychologist, attorney, and educator. We received a question from a subscriber regarding whether or not reactive attachment disorder is sociopathy, and I thought it'd be best to answer the question in a video format versus simply trying to write out a response. And so we can get another conversation going, because I realize that this is a question that a lot of people actually have. So it's a great thing that the subscriber actually asked the question, because it's a great one. Now, let me just say this. Reactive attachment disorder is a rare early childhood trauma disorder, and it's in the same category as PTSD or post-traumatic stress disorder. And there are videos on both reactive attachment disorder and post-traumatic stress disorder if you want to look at those to give you some background before actually listening to this video or after watching this video. Now, basically, reactive attachment disorder is also not antisocial personality disorder. So it's not sociopathy, because sociopathy basically involves violating the basic rights of others. And given the formal diagnostic criteria used to determine reactive attachment disorder, it also does not neatly fit under antisocial personality disorder as like a lesser included diagnosis. Now, the differential diagnoses that are generally considered related to reactive attachment disorder are autism spectrum disorder, specifically intellectual disability, and the depressive disorders. In fact, a child is not even supposed to be diagnosed with reactive attachment disorder and autism spectrum at the same time. And so also the diagnosis is generally not given to anyone over the age of 5 years old. So it really is an infant and toddler diagnosis. But what I've noted is that many are conflating reactive attachment disorder with a variety of other syndromes and behavioral patterns. And basically the public, pop psychologists, and some clinicians have even basically recreated reactive attachment disorder in a way that demonizes these very small children, and in a way that does not comport with its actual diagnostic criteria. So while reactive attachment disorder is not a cluster B diagnosis, it's not a disorder in cluster B, but having reactive attachment disorder may place a child at higher than average risk for developing these and some other disorders in both adolescence and adulthood. So reactive attachment disorder, along with several other childhood disorders, are always in the back of my mind when I'm entertaining the developmental course of all personality disorders, particularly the cluster B disorders. Now, one of the things that is important, and it's missing from many of the discussions related to narcissism, borderline personality disorder, and psychopathy, is the child and adolescent developmental pathways for these diagnoses. Now, that being said, attachment inconsistencies are prevalent in cluster B symptom manifestations, and that's a conversation that people have all of the time about those disorders. But not all individuals with cluster B diagnoses have a known history of child maltreatment as victims. And so reactive attachment disorder is predicated upon a history of pathogenic care during the early developmental period. And so that is crucial. That's a part of the diagnosis. It's not something that you can just take away and just start talking about a child having an attachment disorder. The word reactive is the operative word. So it's an attachment disorder that is reactive to that pathogenic care. Now, all things considered, reactive attachment disorder most likely places one at higher than average risk for developing symptoms related to borderline personality disorder than any other cluster B syndrome. Now, behaviorally speaking, though, conduct disorder, oppositional defiant disorder, and ADHD symptoms, more than reactive attachment disorder, might be more readily seen as the pathway to adult, quote unquote, sociopathy or the related syndromes. Now, we will be addressing this and related dynamics in upcoming videos on cluster B disorders, particularly malignant pathological narcissism and psychopathy. I hope this information was helpful, and for the subscriber, I hope this answered your question. If you have some more questions, if anyone has comments or thoughts, you can place them in the comments section and we will respond accordingly. Hope you're having a great day. We look forward to talking to you and see you again soon. Remember, knowledge is power. Take care.